Welcome everyone to this clean recording of workshop 2 for preparing for CQC, and this is our forum for practice managers and GP CQC leads, and welcome to the second workshop. Right, today we're going to be talking about governance. Now, governance is really fundamental to getting and passing your CQC inspection. Without a good governance, without robust systems and processes, that's what CQC are wanting to see. Without those, you really will struggle to pass your CQC inspection. So it really is a foundation stone, something you've really got to get right in your practice, and from there you can carry on and do lots of your other bits for CQC. But a lot of things it is the foundation for many things that CQC are looking for in your practice. So this is what we're going to talk about today. We're going to talk about governance, and I'm going to give you some ideas and hints and tips about how you can get your governance a bit more up to speed. Many of you do this very well already, so this won't be new news to some of you. Again, and we'll talk about meetings and agendas, and again, some tips and tricks there. We'll look at systems and processes where patients move, or pathways of patients a little bit, and again, why CQC focus on that. Looking at things like document management, CQC do like to look at that. And we will also cover safeguarding today, which I know is something people worry a lot about actually for CQC inspections. But I have to say, when I've been out and about in Sussex quite a lot, people are doing quite well on this, and practices are really good doing this correctly. So again, but we'll go through it just so you can make sure that you're totally on top of it. So let's start with what is governance. Goodness me, it's such a one of these vague words, isn't it? But again, I've actually taken this directly from the GP Mythbusters. So this is what CQC is saying, what governance is in a GP practice. And again, it obviously gives you a clear idea of some of the sorts of things they might be looking at. And again, it's exactly what it says from the GP Mythbuster there. A systematic approach to maintaining and improving the quality of care. I know that still sounds quite vague, but we'll look at this in more detail and some specifics. But again, the important thing I want to draw to your attention to on this slide is that all staff members should be involved, and it should be led by all senior members of the practice who actually understand what their responsibilities are in terms of monitoring and improving quality care. And that's really important. So it's not one person's job, it's not just a practice manager's job. Everyone should be involved, and all of the senior management team of a GP practice should be involved with maintaining and improving good governance within that practice. So again, this is one of these things that people can talk quite well about often, but again, think to yourself, how do we evidence that? What am I going to show CQC? And CQC will ask you, so that does help. But what will I be showing CQC that we've got good governance in this practice? And we'll talk a little bit about that in the next slide. So these are some of the things, again, from the CQC themselves. So this is the horse's mouth that actually this is what they're looking for when it comes to clinical governance. Okay, so again, they are looking for practices, I should say, to actually take information, look at all the sources of information they have about the care they provide for patients, and how they learning from that information and improving things for patients. Okay, so again, things like significant events, patient complaints. Remember, you're looking at the learning from those, and we'll have another webinar which looks at the difference between actions and learning. They're looking at that you're adopting best practice, NICE guidance and medicines alerts. So that is your ardent CQC searches. Again, I will go into more detail on those on another webinar. Patient feedback, don't forget your annual GP survey. That was out yesterday, 9th of July. Everyone should be looking at that. There's a great infographic on that that's out as well that you can see. It's publicly available. CQC do look at it. So make sure you've looked at it before CQC do. And again, if you're slightly under in terms of the annual GP survey, if you're not quite hitting the mark, think about an action plan and discussing that with your senior management team in terms of how you might want to improve that. So CQC would definitely be looking at your annual GP survey. It is publicly available and anyone can see that. So again, you've got your prescribing performance. So that's things like your multiple hypnotics, antibiotics, gabapentin. There is local data that CQC can see around this. Obviously, other bits and pieces around cough, clinical audits, and again, you're seeing that sharing learning within the practice. So again, these are the sorts of things that CQC will be looking at or expect you to look at and have actions or improvements around how you're going to actually improve on your performance in these. If you're doing fantastically well across all of these, that's absolutely great. So as I say, that's really good. But if there's any little areas that could do with a bit more of improvement, understand that as a practice, understand your areas, know where you need to improve, and think about how you're going to be doing that. So again, this is coming directly from CQC. So CQC say when we inspect, we will talk to staff at all levels to get their views on governance in the practice. And if you're thinking, oh gosh, I bet my staff won't know what to say. So really what they're trying to get at there is do our staff understand what their role is in terms of the governance framework? And there is the answer right there. It's about the staff communicating risks and issues to senior managers, risks and issues around potential patient safety or potential staff safety, and those staff feel confident that something might be changed, particularly if those risks and issues might harm patients or might harm staff, or actually will harm patients or will harm staff. So again, they're really looking for that open culture. They're looking for staff to be able to make sure they can raise concerns and make sure that things will be done about it. And again, as I say, you can see there, that's why they want to look at practice meeting minutes, because they will be looking at how effectively your governance systems and processes are. And they do use the meeting minutes as a guide to actually see how you're running your governance systems and processes. That's why they ask for meeting minutes. They really want to look at that. So again, and this is a key way, your meeting minutes are actually a key way of how you evidence your governance process. So again, in your meeting minutes, you do things like discuss and learn from significant events, and you share that with staff. So again, you capture that in the meeting minutes. I know many of you do this, and actually, as I say, you share the meeting minutes with staff, particularly if the staff weren't at the meeting. One of the things that came through, particularly on the workshop, was some practices, not everyone, could do with tightening up a little bit more about actions. So again, when you're having meetings, you really should think about identifying actions from those meeting minutes. How you do that is entirely up to you. You can use action logs if you want to, but a lot of practices actually capture the actions in the meeting minutes. And then when they start the next meeting, they transfer the actions from the last meeting and they start the conversation, start the agenda with an update on the actions from the previous meeting. And that way it shows that you're actually doing things and moving things forward. Otherwise, if you've got meeting minutes that don't capture actions, and then the next meeting you don't then actually discuss those actions and say they're completed, you've got no way of documenting or evidencing that you're moving things forward. And again, I get practice managers saying, well, a lot of the actions are for me anyway, Erika. But again, it's a way of evidencing that these actions have been completed. You don't need to write chapter and verse. They can be very short. You start your meeting noting that these short actions, whatever they are, have been completed and the date they were completed and who completed them. Very, very short. Some people use a very small little table, or you can just note them. But again, it's that evidence to show that things are being done. Okay. So again, something to think about. You don't have to do it in terms of an action log, although there are action logs and templates on some of your systems. It's entirely up to you. You can do it in quite a sort of smaller way if you like, but do capture and document those actions. So again, I would also suggest standing agenda items for your meetings. There's so much stuff to actually do and remember to talk about and discuss. It is quite tricky to keep on track, and a standing agenda will actually help you stay on track, stop perhaps some of those long-winded discussions when people see that there's things that you've got to get through. But also, if there's nothing to say about a complaint or significant event, that's fine. Just note there weren't any this month or whatever it is. So again, it will help you remember to think we need to discuss this at this particular meeting. And the last thing I just want to say on this slide is registered managers and GP partners, so the senior management team, need to be fully involved in the governance side of things to pass the well-led key line of inquiry. They will expect that the senior managers of that practice have a good overview and a good understanding of the governance systems and processes. That is your governance meeting. So again, that is something, it's not just one person's job. The senior management team do need to have that overview. So here I'm looking a little bit more detail and giving you some suggestions in terms of the sorts of things, and ask yourself which meetings and where do we discuss some of these things. So again, it might be one meeting, it might be several meetings, it's entirely up to you. It honestly doesn't matter, but where are you starting to discuss these things? Where are you actually noting these things in the minutes? Where are you taking the actions from the meetings where these things come up and looking at the actions again in the next meeting that follows? So again, you've got all sorts of things on here, your significant events complaints, as we talked about, your risk log. Remember, CQC do like a risk log. I'll be talking in more detail on that on some forthcoming workshops. But again, a lot of the premises risks they like to see on a risk log. So as I say, think about if you haven't got a risk log, there's lots of templates on some of the systems that some of you have. So think about using some of those templates. Safeguarding, we'll talk a little bit more about today. And as I say, anything in terms of your RAD and CQC searches, progress, really good to have an overview. You don't want to let that slip and to start build up and you're not, the senior management team aren't aware of that. So again, how are you keeping that monitoring and that overview of progress on the RAD and CQC searches? Staff feedback is obviously really important. So again, how is that discussed? How do you do that? Do you have a staff survey? What information gets fed up to the senior management team? And again, what information, relevant information, gets fed down to the staff from these meetings? Practice vision and values or practice strategy, particularly in the new quality frameworks. We'll see they're only draft at the moment, but we're definitely seeing more focus on the practice strategy and monitoring yourself against the practice strategy. So again, it would be good to include that occasionally, maybe every 6 months, to actually review your practice strategy and think about that as well. Okay, moving on. So lots of people, when they say to me, "Oh, Eric, I'm preparing for CQC, I'm going to start with all the policies," and they do a big kind of session and spend hours and hours and days and weeks and months reviewing every single policy. And I know many of you have actually got lots of policies. You've got at least 100 policies, many of you. It's like painting the fourth bridge. What I would advise you is try not to get down a rabbit hole of just doing policies and not moving forward with all of the other CQC preparation. Okay, you could spend days, weeks and months just doing all of your policies, and actually CQC, as part of a CQC inspection, will only ask you for a handful of policies. It's certainly no more than 10, and we know what those policies pretty much are. So a top tip here would be focus on the key policies CQC are likely to ask for. For example, CQC have never asked any practice ever, to my knowledge, for their guide dog policy, and you've probably got one. Okay, so if you've got one, don't worry. If you haven't, don't worry. But what I'm saying is keep your key policies, keep those ones up to date, keep those ones refreshed, keep those ones live, and try and get on with all of the other prep at the same time. Don't go down the rabbit hole. It would be my advice of just doing policies and never getting past that. Right, so as I say, moving on, there is a new focus in the draft CQC quality statements, which we talked about in the last workshop. So, to move this here. So these are some of the draft taken from the draft quality statements, but I just want you to see as they come up that actually there is going to be much more emphasis. These are only draft, but you can see the direction of travel in terms of policies and the new framework focus. There is a lot more emphasis on the digital agenda, and we will see this, as I say, in the new framework focus. It would be good to be starting to gear up now. You don't want to be trying to pull this out the bag quickly for CQC. So whoever your digital lead is, have a think about some of these statements, have a think about how you'd evidence these, and actually start gearing up now on evidencing for the digital agenda for CQC. Again, I don't think these will change too much. I think that there will be versions of these within the CQC inspections. They're not featuring at the moment, but I would expect these to feature from January onwards. So CQC often like to focus on patient pathways and transitions, mainly because these are known and it's well known that this is where patients can sometimes experience harm, or as perhaps we might refer it as fall through the cracks. So again, they do like to look at these, how you're moving patients, referring patients to hospitals, particularly the urgent 2-week waits, how patients, when they get referred back to you, when they're discharged from hospital, what that process is, test results, how are you keeping on top of urgent things, all of these sorts of things. Obviously, they're all around patient safety. So again, think about your systems and processes and ask yourself, are they robust and are they capturing the urgent issues and problems or dealing with that? So when we're looking at things like urgent 2-week referrals, have you got safety netting if patients don't actually attend that appointment? So if they DNA, do you have a safety netting process within your policy or standard operating procedure, SOP? Make sure that you've got a system for that. Again, test results that come back to your practice, maybe going to DocMan. How are you picking out the urgent ones out of the more routine ones? What's your system? What's your process? And again, discharges from hospital. Your pharmacist will quite often look at those discharge letters. How do you make sure they're looked at and medications are changed if required in a timely way, making sure that the urgent ones really are focused on? And again, if it's a pharmacist that would look at that, but they go on annual leave or go off sick, who's picking up that process? And again, with test results, if you have test results that certain GPs will need to look at, if somebody's away or on annual leave or off sick, who picks up those urgent test results? It's really making sure that there's no single points of failure in all of those systems and processes that could affect patient safety. They will be looking at things like DocMan. Is there any backlog and how you're managing the backlog to make sure, like you say, or sometimes there's some awful dumps going into backlog, into DocMan, I should say. So again, how are you sorting the wheat from the chaff? How are you making sure that urgent patient things, patient safety is actually been actioned and identified in some of those big DocMan dumps? We know what they're like. They're not great, are they? As I say, they could look at summarising new patient notes. Are you keeping to the standard on that? And there was a practice that did get pulled up for having open tasks on the system of staff, clinical staff that had left the practice. Now, most of you, I've been talking to you, most of you are quite good with this actually. You do have a checklist when staff leave leave your practice, and you do look at shutting down or looking at addressing any open tasks. But this practice hadn't. So again, look at your policy or your practice for when staff leave your organisation. Is everything done? Is that part of what you would do in terms of your system and process? Right, let's move on to safeguarding. So safeguarding, as I say, it's actually people are doing really great on this, so that's really good to hear. But the usual things that CQC will be looking for is a policy, obviously. They will definitely be looking at how you identify vulnerable children and adults on your records, what flags you use, how you do that. Particularly, I've seen in Sussex, they like to see a was not brought policy, and I do have a template for that, which I've got from the ICB safeguarding leads for primary care. Very happy to share that and make sure staff would know what to do. Again, as I say, put the link there to the safeguarding information for Surrey and Sussex. That's quite handy and would be really useful information to have in your policy. They will obviously look at mandatory training to show that all staff are up to date with the safeguarding training, and it must be 100% when CQC look at that mandatory training log, and that's appropriate to their role, obviously, and it needs to match your policy, what you say on who has what type of training for safeguarding as well. So ideally, you would be reviewing your vulnerable children and adults, your at-risk children and adults with the local health visitor or social worker. But I know I've only ever met a couple of practices that have ever managed to do this. They are as rare as hen's teeth. So in the absence of not being able to meet with them, don't just do nothing. What you need to do is your safeguarding lead or a GP clinical lead needs to review that list and see if there's any actions required in terms of what might be required for follow-up. Are they not being brought for immunisations, that sort of thing? Is there issues, vulnerable adult hasn't turned up for their health check or things like that. So again, they do need regular review, is what CQC would say. What CQC deem as regular is up to the practice, so you can decide how often you do that, but you do need to make a note. Again, you can't necessarily make notes because these is very highly confidential information, but again, report in to your clinical meetings to say that the clinical safeguarding lead has just recently reviewed all the vulnerable children and adults. Unfortunately, the health visitor wasn't around, or we can't get hold of them, but we've updated some records and we've asked for some follow-up. So you can give a general overview, and that can be noted in general meetings. You don't need to go into specifics, okay? Obviously to protect patient confidentiality. So, but do feed in when you do a safeguarding review, because then it can be noted that actually happened. And if you're looking for, some people were asking about some extra webinars or free training for safeguarding leads. The Sussex Training Hub has some free webinars and extra training on there. So scroll down to the safeguarding section and you can do some extra training there. And again, if you're getting some particularly knotty problems with any particular patients or families, there are the local safeguarding leads there. There's the lead for Sussex is there. So do reach out and ask them to help you, because I know some of these situations are quite tricky. So again, CQC would like to see that out-of-hours services have relevant safeguarding information that should be on the shared care record. And there's a couple of things coming from the new framework. Again, it is only draft, but it's good to get a little bit of an idea of how things might be changing. You can see there's information they'll be asking staff around what is a closed culture, and we've talked a little bit about that already. They will ask staff about that, but perhaps in a slightly different way at the moment. And there's also potentially coming, there might be questions around deprivation of liberty safeguards. That mainly will apply to people who have got care homes. As I say, it's not featuring in CQC inspections at the moment, but it's something to have a consideration for clinical staff that look after care homes, perhaps. Currently, CQC will ask the staff questions about if they had safeguarding concerns, what would they do? And that's commensurate with their role, obviously. And they do like to know that staff know who the safeguarding lead is in the practice and who they would go to if that person was away. And that is the end of the session today. So thank you very much for listening. I hope you found it really useful. Just one request that you have a think about what you've listened to today, you have a reflect, and as I say, reach out to me if you're not sure about anything that's featured in this recording. Please feel free to reach out to me. My email is on the front of the slides, at the first slide. And as I say, think about what you might implement in your practice. Thank you very much.